Good morning guys. Today in this video what I'm gonna talk about is a topic which you all are very well aware about. It's COVID-19. What you need to know regarding COVID-19. Everything from A to C with updated contents. And in this video what I'm gonna talk about, the content that I'm gonna talk about are what is COVID-19, how it spread, the variant of concern and its mutations, symptoms, what to do if symptoms present, herd immunity, post-COVID conditions and side effects. This topic, herd immunity, post-COVID conditions and side effects, are one of the important topics that you should be aware about. Prevention and vaccination and COVID-19 and blood donation, COVID-19 during the pregnancy, childbirth and breastfeeding time, and the summary. So let's start to the COVID-19. It's been more than 1 year you are facing this disease in our society. So you might be well aware about this. COVID-19 is the disease caused by a new coronavirus called SARS-CoV-2. This name COVID-19 was given by WHO because coronavirus disease which was originated in 2019. And why the name was given corona? See here, you can see like this is the structure of the coronavirus. It has the genetic materials, membrane, envelope and the spikes. In the spikes, these spikes are crown shaped. Here club shaped spike or crown like peplome spike looks like solar corona. So as the spikes are crown shaped, the word crown in Latin means corona, so they are given the name corona. So I'm not gonna explain much about the what is corona and stuff, because you are well aware about it right now. And this is the classification of COVID-19. Like the Nidovirale is the order, and Coronaviridae is a family, and this is the subfamily Coronavirinae, and this is the genus. And this coronavirus is in the beta coronavirus, and here you can see SARS-CoV-2. Even I have given the description for you guys to read, so better you can go on with the reading part. So this is a genetic materials, and this is the electron microscope image. So as I said, you can see it's kind of a solar sun spike image or solar kind of image, and it is having a sun ray pattern as well. I'm just giving it for a knowledge only, so I'll be moving on to the main topic first, and how it spread. This is the most important, one of the important part. The virus that causes COVID-19 is mainly transmitted through droplets generated when an infected person coughs, sneezes or exhales. These droplets are too heavy to hang in the air and quickly fall on the floor or surface. Now you all are well aware about all this part, but in recent days the virus is mutating day by day, and it is getting bigger and stronger. So it is more spreading faster than ever before. It is in the air, in our surrounding, if an infected person coughs or sneezes or anything. But that earlier it took time to infect us, but now it's quick. We can be infected by breathing in the virus if you are within close proximity of someone who has COVID-19, or even by touching the any surface which he has touched. Okay, so what are the variant of concern? There are thousands of variants right now of the coronavirus, but which are the variants of concerns? Here the UK or Kent variant, also known as B117 variant, South African variant, also known as B1351, Brazil variant, also known as P1, and the most dangerous or most troublesome variant right now in our world is Indian variant, also known as W mutation variant. So, like the mutation of concern, here there are few mutations which are of concern right now, especially these mutations are of concern in India. N501Y, E484K, E484Q, L452R, N440K, E484Q plus L452R, and this the last one E484Q and L452R is the double mutation which is predominant in India right now, and it is in 16, including India, 16 other countries, like 15 other countries are having the double mutation virus variant, and which is of main concern because here you can see E484Q means the mutation seen in Brazil and South African variant has emerged independently. Sorry, I'm talking about the E484K, no, Q, independently. Like E484K, it also helps virus to evade defense, immune defense. So here what you can see what is E484K and L452R. The impact mutation on the virus structure and the function needs to be studied, but studies have found that this mutation offers significant adaptive value to the pandemic coronavirus. So right now what double mutation is doing is it's easy to break the immune defense, because when the virus gets into our body's immune system will be reacting, but this time it is mimicking. So our body is not, without our bodies going to any surveillance, it is affecting us directly, like it is skipping the immune defense and attack our body, and then it mutates as quick as possible. So this is what it's doing right now. So even before our body finds out that a new person is in our body, like the virus is in our body cells, before that itself it has attacked us. So it's a main mutation of concern, and people at high risk categories, like who are at high risk, you might be or you are aware about it: older adults, pregnant women, people with medical conditions like heart issues, lung issues, or cancers, other kind of serious chronic issues, people with weak immune system, obese people, and physically inactive people. Studies like done by some researchers have found that before 1 year, like for example in 2019, there were some people who were physically inactive. So those kind of people have high chance of getting COVID than those who are highly active. Means you have to do regular physical exercise, and now the virus is mutating and it's even affecting the children severely. So they are also at high risk because they are our future generation. They are the ones who are going to live in this world after us, so it's affecting them as well. And okay, I will be coming to one topic later. And then smokers. In this category I didn't specify anything about the frontline workers or others who are in the front line fighting against the COVID-19 and protecting us. These categories, what I said, are from the common people. And here, what are the symptoms? The most common symptoms are fever, cough, tiredness, loss of taste or smell. Like most commonly people are having some respiratory difficulties. That is one prominent symptom of COVID-19. And here some serious symptoms which need immediate care or immediate medical assistance is shortness of breath or difficulty in breathing, loss of speech or mobility or confusion. If someone is so much fatigued, tired, dizzy, and they are not aware where they are, what they are doing, they don't know what to speak, that kind of situation is so much harmful. And if they're having some chest pain or any other conditions, is serious. And what are the less common symptoms? Less common symptoms, it doesn't mean that these symptoms won't come. These might come, but if this comes, it can be COVID-19 or it can be of other disease as well. But better you should check whether it's, go for testing, get to know whether it's COVID-19 or whether it's some other disease. So what are the less common symptoms? Sore throat, headache, body pains, muscle pain, joint pains, then diarrhea. Because diarrhea right now in the mutated version of COVID-19, people are having more gastrointestinal disease like abdominal pain, diarrhea, even nausea and vomiting, there GERD. There are so many kind of abdominal or gastrointestinal disease, as well as the earlier they had the respiratory issues were there earlier as well, but now it's more severe, and the bodies are having rashes, discoloration, especially around the neck, fingers and toes. It might be swollen like edematous, and red eye or just like conjunctivitis, and even your eyes feels irritated as well. Like I said, nausea and vomiting. Dysfunction of ear tube means you might have some hearing difficulties right now, because earlier it was like smell and taste was sensation was gone. Now it is having hearing difficulties also. Then dry mouth. Here your tongue will be so dry, and even some people will feel dehydrated so quickly. So you have to keep hydrated in order to prevent this. And oral lesions in your mouth, tongue, lips, everywhere you will have lesions like oral ulcer or something like that. Even there is a special condition called COVID tongue, in which just like the dry mouth, people who are having COVID-19, their tongue will be so much kind of anemic, kind of discoloration, tongue dryness, and so many changes like that. So whatever the symptoms you have, if you ever doubt it's COVID-19 or something, just consult your physician or healthcare worker and get tested, or take self-care and you for at least 14 days. And if you are having any further difficulties, like I said, regarding the serious symptoms, then you have to consult your physician, not to wait even a single second. Better consult physician. And because right now the COVID-19 is not having any symptoms, like symptomless COVID-19 are there in our society. So even after the RT-PCR or antibody antigen testing, whatever it is, they are still negative. Actually it's false negative only. In reality they are positive. So in those special cases, if they doubt, the doctors might be asking you to do X-ray, CT or USG. And in X-ray you can see like, okay, the doctors will be noticing about the changes in your leg. These are just few examples only. There are more X-ray images, more changes, because there are kind of 50 or 70 changes, like X-ray changes which can be found, or CT changes or ultrasound changes which can be found. But this is just one example only, but there are many. So don't imagine that, oh, if a COVID-19 patient is there, his X-ray will be only like this. No, there are many changes, but this is one of the common or prominent change which we can find in our society. So in the X-ray you can find the glass ground opacity, and you know, glass ground opacity is like in the area, or is having an increased attenuation in the lungs. So even it is having see in CT also you can see the glass ground opacity, and here you can see it's kind of crazy paving, like it can be said as crazy paving. And this is just the appearance of glass ground opacity with superimposed interlobular spectacles, and thickening and interlobular spectacles are here so much thickened. Like here this kind of pave is kind of like crazy paving of the floor. Yeah, here it's written crazy paving pattern, and consolidation as well. And in the ultrasound you can read like increased B lines, consolidation and air bronchiogram. So increased B lines in normal ultrasound you cannot see the B lines. So in this special case, like there are some special cases regarding the lung niches where you can see B lines, but like alveolar interstitial syndrome you can see the B line. But here in COVID-19 patients also you can see the B lines. It's like B lines are not common, so in this scenario the B lines are shown, which means it corresponds to the subpleural thickened interlobular septa. So this is a matter of concern as well. Multiple B lines from focal to diffuse, which spared area 64 representing thickened subpleural interlobular septa may also manifest as a light beam sign and evanescent broad-based petrichal reverberation artifact arising from a regular pleural line. So here the pleural thickening. So from the regular pleural line you can see it is kind of a rising beam sign. See here from the regular pleural line the beam signs are rising, and these like B lines are just not common. So the doctors might be asking you to do the radiology of COVID-19. And next topic what I'm going to talk about, what if the symptoms present. So if a person is like, there are cases where they are symptomless, but if the symptoms present, first thing, self-isolate yourself, then consult a healthcare worker and inform that you are having symptoms. And most thing that you have to do is 3 T's: test, track, treat. So for testing, there are RT-PCR, antigen, antibody testing. And for tracking, isolate yourself and make sure from whom you got the COVID, and also tell to all those persons who have been in contact with you, so that we can prevent a super spread. And surveillance is important for you as well as for the others. And make sure you get the proper treatment. Treatment never comes as hospitalization only. Even you can do home quarantine or hospitalization. For mild cases, better you can do home quarantine, and for medium and severe cases you should go for hospitalization. And if you cannot do proper home quarantine in mild cases, or if you're not sure that, or if people are coming to visit you, then go for hospitalization. Don't wait. And even though you are doing home quarantine, there are some things you have to be aware about. Like for example, okay, when you are doing home quarantine, you have to inform your nearest healthcare department, government department, that you had been affected with COVID-19, and you must not allow any visitors to come and meet you, even though he might had COVID-19 in the past and recovered, but he's not allowed to visit you. Like why, I'll be telling in the coming topics. And you have to eat healthy food. You have to eat well cooked food, and it should be healthy, like proper diet with like required or minimum amount of salt, sugar and everything, and eat food 3 times. Wake up in a like early in the morning, sleep early at night, do some physical activities, not so hard activities or anything, just some physical activities, and take proper rest, and if required medication as well, because there are many cases where you have recovered just with the food and like healthy food and physical activity. In some cases only you might need medication like antiviral for 3 days or something, that's it. But in some medium and severe cases you might need oxygen because your SpO2 level might go down. So what to do if you are home quarantining? Like daily in the morning and evening at least, but if possible morning, afternoon and evening, check your SpO2, and if the SpO2 goes below 92 or below 90, then it's a matter of concern. You have to contact your healthcare facility and inform them you're having in that time you might have some breathing difficulties as well when the SpO2 goes down. If possible you can check the BP. If you have the BP apparatus, you can check the BP, SpO2 and the temperature. These 3 things are most important to note down. So if you have COVID-19 and doing home quarantine for the 14 days, you have to check your SpO2, then BP as well as temperature, and you have to note it down in a paper like kind of chart, and you have to keep that record with you, so you can know the variations as well. And in your family, if you are the only person who is having COVID-19, just get a separate room, isolate yourself fully, and keep apart from everyone else. And you have to use like utensils, plates or things only for you, and try to clean it by yourself if possible, and frequently you have to open the windows for proper ventilation, and like I said, food, medications and so on. And if you have COVID-19 and doing home quarantine, make sure that you clean your home very frequently, and it should be like sanitized. Still, I'm telling you once again, home quarantine or isolation is not the extreme solution, since there are no other option or hospital beds are full. Better you can do home quarantine. But if you have any kind of other illness, even you have diabetes or some other chronic illness, then don't do home quarantine. Better do hospitalization, because if you have some other health issues, then those health issues plus COVID-19 might be worse. So only I'm suggesting you to go for hospitalization. Okay, the time is running so fast. Okay, I'll be moving to the next topic, and herd immunity. So if you acquire herd immunity, means the immunity against this virus, in order to protect yourself from the virus, it can be achieved by 2 ways. One is like the person who had COVID-19 recovered from COVID-19, they will have herd immunity, and the best way is vaccination. So okay, like I said for the first part, if you have had the COVID-19 earlier and you have completely recovered from it, you have herd immunity, so you can go out, meet person who have COVID-19 or not, nothing like that. Even if you have herd immunity, it doesn't mean that you might be immune to the virus. You might get COVID, but the chances are reduced. And this herd immunity, right now we don't know if you have recovered from COVID-19, how long it will last. But most studies have claimed that maybe 3 to 6 months a person will be immune to COVID-19 if you were affected with COVID-19. So, and exposing a society to achieve herd immunity by affecting the virus is not the solution, which is not ethical, as well as which is not at all safe, because we don't know what are the changes, like physical, biological, physiological changes that we will have in the future once if you are affected with COVID-19. Since this disease is new in our world, in among us, we don't know, like studies are just going on only after if you had COVID-19 what all changes you have. But we, even though the science everything is so much advanced, we cannot say that right now. The bodies will change slowly only, so better not to get exposed to this COVID-19 disease. So if you have a chance to get vaccinated, do it. Don't wait or don't listen to any propagandas or any fake news telling that vaccination is not safe, vaccination might kill, vaccination people are getting COVID-19. No, don't listen to any of this, just get vaccinated. So at least, even though like there are cases where vaccinated people are getting COVID-19, but if you get vaccinated, your chance are reducing. You might, even after vaccination, if you get COVID-19 also, you won't be having serious health issues or serious conditions. So we are asking you to get vaccination. And here, the most important topic, post-COVID condition. Right now, like I said, no one is clear about what all changes in our body, because it's been just started in December 2019 and now it's April 2021. So in the meantime, we cannot say what are the changes, because there are long-term changes which might come to, which might affect us, like in near future, after 3 years or after 5 years from the like you being affected with COVID-19. So here I'll be telling about some changes which are clear right now. If you have recovered from post-COVID, like post-COVID, there are three conditions, like long COVID, multi-organ effect of COVID-19, effect of COVID-19 treatment or hospitalization. Okay, so anyway, I won't be suggesting anybody to get exposed to COVID-19 so that you will be immune or anything, because it's not safe. The best way is prevention, so that you won't be having any complication. But okay, you are affected with COVID-19, I am having serious complications, in future what will I do, so I have to live the life today, I have to enjoy that much. No, nothing like that. You can beat those complications by eating healthy. If you are a person who had COVID-19 in the past, just make sure that you are doing the proper preventive measures and you are eating healthy food, you are doing regular physical exercise. Then you might not, like most probably you might not, like 80% 90% chance there that you might not have any serious complications or any complications in future. But we cannot neglect that if you are a COVID-19 patient, or if you get COVID-19 right now, if you get COVID-19, for sure you will have serious complications in future, because the variant right now is so much advanced. So long COVID, here long COVID is a range of symptoms that can last weeks or months after first being infected with the virus. So these are even after you recover from COVID-19. These symptoms like tiredness, fatigue, headache, loss of smell, dizziness can last more than a month, maybe 2 months, 3 months. It depends on your health condition, your eating habit, your physical activity, depends on all these things. So even there are many cases. Okay, whatever I am talking is with evidence and with experience only, so I'm not talking with just some theories. So there are many cases where people had physical issues like breathing difficulties, or kind of not able to concentrate that much, like brain fog or chest pain, palpitation, tiredness. Even after COVID-19, many people won't feel much active like before, because they feel so much tired, or they feel body pain, even depression. So this can last for weeks to months. It depends on your physical condition, immune conditions, and so on. And next part is multi-organ effect of COVID-19. This is a serious issue. Multi-organ effect is, it affects the body systems like heart, lung, kidney, skin, and brain functions. So here your organs like heart, brain, kidney, skin, it gets inflammation. Solely it is named as multi-system inflammatory syndrome. So all these organs, like maybe your lungs and kidney will be inflamed at the same time, or heart and kidney, or skin inflammation. So this is kind of an autoimmune condition, and this happens when your immune system attack healthy cell. This autoimmune condition happens when your immune system attacks healthy cell in your body by mistake. Like it might think, okay, this is COVID-19, so we have to attack, let's attack, and causes swelling, and you might feel difficulties like kind of burning sensation, irritation, like that. So this is one important complications after COVID-19. So it has two categories. One is like multi-system inflammatory syndrome in children and in adults as well. So in children, so we don't know like what changes it brings to a child's body right now. So they are just children or teenager. When they become adults, we don't know what all changes they have in their body because of this COVID-19, like physical, physiological, or biological changes they have. So because studies are just going on only. So like most of the children's right now like have went to the pediatrician telling that they, like their parents were telling they have fever or some coughing, nausea, vomiting, even diarrhea, neck pain, rashes along the body, like in the neck, in the back, then abdominal pain, like they are not they don't want food, they are not willing to eat any food, they have so much gas, and they have blood clot, like their eyes are red, feeling tired, they are not active like before. This kind of things like parents are telling when they are visiting the pediatrician. So if your child is having any symptoms or any health issues after COVID-19, after recovered from COVID-19, you should consult your doctor. Don't wait for any moment, or don't wait okay after 2 days he might recover. Nothing like that. Like he might recover, it doesn't mean he might not recover. He might recover, but better you have to go visit the doctor. And most severe cases are like trouble breathing, pain or pressure in the chest, like they feel new confusions. When we are asking them to do something, they feel like or like they'll be standing like they are in another world, or confused, they don't know what to do, like that. If their skin color, like our bodies having blood vessels and our skins are red, like kind of pale, not pale, it's kind of reddish color. So if your skin color turns pale or gray, and if you feel dehydrated, if your child feel dehydrated, take them to the doctor as soon as you can. And in adults, just like the children are also having the same symptoms like fever, vomiting, diarrhea, neck pain, rash, chest tightness, tired feeling, like that. And even they have low BP, their BP might go low, and they might have some serious conditions which we are right now not sure, but the studies are just going on only. Next topic, what are the side effects of COVID-19? Not about the vaccine but about the COVID-19 disease. Like if you are recovered from COVID-19, what can be the side effects that you are having right now? Like I said, studies are going on and nothing is clear what are the side effects. But just like I mentioned, the post-COVID symptoms, these symptoms might last for 6 months to 12 months or even more, depends on your physical condition. So physical condition and environmental condition, you have to eat healthy, stay physically active, don't do like if you have any difficulties, consult the physician or your doctor, family doctor or whoever as quick as possible, because some studies have found that the people lost their smell sensation and taste sensation forever. Even those kind of people are now under observation and under studies, like they have lost their sensation forever. Now they cannot sense or taste any food. So you can imagine, most everybody likes to eat something special, but you have that food in front of you, but you cannot, when you are eating, you cannot taste it. So just imagine those condition. It is too bad. And so better not get affected with COVID-19, but if it comes to you, you can stop it by proper preventive measures. But if there is any fault in your preventive measure, then you might get affected with COVID-19. But if you are going with the proper preventive measures, the chance of getting infected with COVID-19 is so less. And in some recent studies, it's found that the male hormone testosterone is low in person who, like before COVID-19, their hormone was in normal range, but after COVID-19 their testosterone hormone, like the male hormone, so low, and now the doctors are giving him the medication in order to maintain his hormone level. So, and there are many cases where the organs became swollen or edematous. So these are some side effects which are not like completely clear, because the studies are going on with these peoples. So like I said, post-COVID symptoms are most common, but these are some rare cases which I said the testosterone hormone are low, like you will lose your taste and smell sensation forever. But chances are there, like 1 in 1 million can get these kind of issues. So don't be 1 in 1 million. Better cut off the chance by preventing COVID-19. So prevention and vaccination. You might be well aware about this topic from the last 1 year, because everyone, news, TVs, your government, everyone is telling this 24/7. Maintain physical distancing. Okay, keep socially connected, but be physically distanced. Okay, maintain physical distance at least 1 meter, but preferable is 6 meters distance from one another. And clean your hands frequently with alcohol rub or proper sanitation or water and soap, and frequently. And don't touch your like eyes or nose after touching any surface. Better, even if you have some irritations or something, just don't go to scratch your eyes or anything. And wear mask properly. So one of the preventive measures is mask. Adjust the mask without leaving gaps on the side or on the top and below. Cover your mouth, nose and the chin properly. So use a mask that fits for you. And if you have any respiratory difficulties while you wearing a mask, try wearing another mask which is comfortable for you. And avoid touching the front of the mask. Like people will be touching in the front for removing, even for putting it properly. So make sure once you put it properly, make sure it's a mask that fit for you. Don't wear any loose mask or anything. So next, what not to do while you wear a mask. Do not use like right or damn mask. Like don't use any mask which is torn or which is having any small hole or which is wet, or don't reuse the mask. Do not wear the mask only over your mouth or over your nose. Do not wear loose mask, and don't touch the front of the mask, because after touching the front of the mask you will be touching any other surface. Some other people will be, or your kids will be touching that surface, and your front of the mask might be having the coronavirus. So after you touching there, you'll be touching on the surface, and your kid will be touching the same surface. They'll be putting their hands in their mouth or eyes or somewhere without their kids. We cannot scold them, like they does these kind of things, so they might get COVID. So better you should be cautious in all those things. And here these are the things which you shouldn't do, so you have to make sure. And most common practice in our society nowadays, you will be wearing the mask, like to show that to police and government that I have mask, see, and this is my new mask. Can you see, like that you will be wearing, but not properly. You are just wearing it on your head or on your neck. That's not the proper way to wear a mask. You have to wear it properly, covering your nose, mouth and chin. So tie it properly. We are asking you to wear the mask for your own protection only. I'm not gaining anything if you wear a mask. I wear my mask, I do proper prevention, I'll be safe from COVID-19. If you does that, you'll be saved from COVID-19. COVID-19 is not just a flu, like what people say, oh, it's just a flu. It's not just a flu. It's a serious disease which you should prevent. It's a disease which killed thousands and millions of people. You are not worrying because none of your loved ones have died, but this disease have killed so many people, others loved ones. So better, and it might do some severe changes in your body. We don't know right now. No one is clear about what changes it can bring. So better prevent it. And you have to keep at least 1 meter distance from one another. If you can more than 1 meter, like 6 meter or anything, best. Don't be in crowded or get together or anything. And if you want to meet someone, meet in the outer space, like open air, not in an enclosed room. But if there are some situations you have to meet in an enclosed room, but if you are meeting in an closed room, open the windows and doors for proper ventilation. But if there is anything, meet outside, and reduce the time of being in contact with the other, like being with other person in the same room, or talking with the other person in the like outer space, just for your safety. And hand wash. These are the steps for proper hand wash. Follow these 7 steps and hand wash properly and regularly, thoroughly with alcohol based hand rub or wash with soap and water. So these are some do's and don'ts, like don't get close contact with people who have COVID-19, who have some fever or any symptoms. Don't touch your eyes, don't spit in the public, and cover your nose and mouth with handkerchief while you cough or sneeze, and after that you throw that tissue paper or in a proper dustbin which is closed. Don't throw it in the public or on the road. Be matured, be educated, be civilized. Throw it in the closed dustbin. Don't spit in the public. And another preventive measure is vaccination. Vaccination can save millions of lives. So you are well aware about it. And what are the vaccines available right now in the market? Like there are many vaccines available right now, but when I'm talking about Indian ones, Covaxin, Covishield and Sputnik V vaccine. Sputnik V vaccine is coming to India soon, like from the month of May. There will be more Sputnik V vaccine, and they will be used for emergency use only right now. But Covaxin and Covishield are given to the population right now. As of today, 45 plus age group of 45 plus can get vaccinated, and starting from May 1st, 18 plus can get vaccinated. And other vaccines which are available in the market around the world are Johnson & Johnson, Moderna, Pfizer, Sinovac, Novavax and so on. And being an Indian, if you want to do some like registration for vaccination, here is a website like link ID. You can go to this link ID and register yourself with your phone number, and or you can go to the nearest vaccination center for getting vaccination, because there are some sport vaccination, but you have to take your ID card and you have to be under eligible age group. And while you are going for the vaccination, if you have any health issues or if you are under some medications, it's your responsibility to tell the vaccinator that you have this disease before vaccination. You have to tell it that you have this disease or you are under medication. So yeah, if you have the prescription, take that prescription along with you. And even after vaccination, you have to do the safety protocols, preventive measure protocols. Be at least 1 meter away from one another, cover your nose while cough or sneeze. All those things you have to do properly. So what should I do and expect after getting vaccinated? After getting vaccinated, you have to stay for at least 15 to 30 minutes in that the room, or like they will be telling, the vaccinator will be telling, stay in the other room for 30 to 30 minutes at least, 50 minutes at least to 30 minutes. Then they will be letting you know when you should come for the second dose. If like for Johnson & Johnson, it's a single shot vaccine, but other vaccines are 2-shot vaccines, so they'll be letting you know when you should come for next dose. And in most cases after vaccination, you might feel some difficulties such as arm soreness, mild fever, tiredness, headache and muscle or joint pain. These are some common side effects, minor side effects after vaccination. It's not of a big deal, and you might even have some redness or tenderness at your vaccination site. But if these symptoms are not going even after 24 hours, so if these symptoms get worse after 24 hours, you must inform the nearest health center regarding this issue. And if you experience any immediate, if you are allergic to any medicine or something, just inform your vaccinator that you are allergic to some medicine or blah blah, and make sure that they are informed before vaccination. So if you experience any immediate allergic reaction to the first dose of vaccine, you should never get a second dose. It's extremely rare for some health reactions after getting vaccination, but if you have any issues, then don't go for the second dose. And okay, before I come to this topic, like there are many things that are going on in the society. Okay, for example, after getting some vaccination, you have blood clots. Okay, you have blood clots. It is not minor side effect, but it's a side effect after. But it's not mandatory that everyone should get that blood clot. But you have a treatment for that blood clot. Okay, if you have any issues, health issues, tell your doctor, tell your healthcare worker that you have health issues. They will be doing further examination in order to help, in order to save your life. But what COVID-19 brings to your body, what changes it brings to your body is not yet clear, because studies are going on only, and we don't know how worse it can affect us. But for blood clot after vaccination, we have treatment. So just get vaccinated, prevent yourself. Okay, now the mutations are going on, new variants are there, so people might say, oh, this virus has mutated and this is a old vaccine, so it's of no use. See, you have to know one thing. These virus mutation were in our society earlier, like E484K and so on, were there in our society earlier. At that time also we had the vaccine, and these viruses are immune to those vaccines, but now they have joined, like they have combined and started attacking. It doesn't mean like individually these vaccines were effective to those mutations. So even though they have joined or combined, still the vaccine is effective, but the efficacy might be low, but still it's effective. Earlier, if the vaccine was effective for might be around 80% to that mutation when he was alone, and now he has joined a group, so now it might be 60% efficiency. The same virus which was efficient earlier 80%, earlier it was 80% efficient, now it is 60% efficient. It doesn't mean that that the vaccine is not efficient or anything. Okay, so you have to know that thing, you have to get vaccinated. So get vaccinated, don't delay your vaccination. If you have the vaccine in your place, and if you are eligible, go for it. And in India, after May 1st of 2021, people aged above 18 can get vaccinated. And right now in our society, like we are having like the COVID patients as well as other cancer patients, and many people need blood. But because of the pandemic, many people are not willing to donate blood or join any blood donation, because they are afraid whether when they are going there they will be affected with COVID-19 or anything. Yeah, chances are there, but when you are going, you have to wear proper mask, get your hand sanitizer with you, do proper physical distancing from one another, so you won't be getting any COVID-19. So as of now, there is no cases which has reported that blood donation like can bring COVID-19 can be transmitted through a blood donation. And healthy individuals are now needed for blood donation, because now the blood banks are shortage of blood, and we need more blood. So blood donation is required. You are most welcome for the blood donation. And there is no, like, if you have got the vaccination And if you know the name like AstraZeneca vaccine or Johnson & Johnson or Sinovac or whatever the vaccine is, if you know the name, then while you are going for the blood donation, you have to show that vaccine certificate to the doctor in the blood donation camp, and you have to tell them that okay, I have got the vaccination and this is my vaccine certificate. So they'll be telling you what next, what you have to do, or are you eligible to give now or should you wait for some days. But if you don't know which kind of vaccine you got, or if it's some live attenuated COVID-19 vaccine, then you must wait for at least 14 days. You can give after 14 days or 21 days of your first vaccine dose, of your complete vaccine dose. Okay, so you have to make sure about that thing. And if you are a fully recovered COVID-19 patient, like you had COVID-19 and is confirmed by a physician or doctor, and now you have completely recovered from it, then your plasma is having the immune to fight against the COVID-19. So your plasma is, you can donate your plasma so that it will be used for saving other COVID-19 patients. Like there are many patients who are in the ICU, they need blood or plasma. So if you are a COVID-19 recovered, fully recovered patient and you don't have any symptom, you are physically healthy, you should go for donating your blood and plasma, because this can save another life. But you have to wait for at least 14 days. Like after you recover from COVID-19 completely, you have to wait for at least 14 days for your donation. And you have to make sure after vaccination or after you recovered completely from COVID-19, you have to be physically healthy, and at the time of donation it should be more than after 14 days only you can donate the blood, and you have to be physically healthy without any symptoms at the time of donation. And how the COVID-19 might affect the pregnancy of the pregnant woman, childbirth and breastfeeding. So pregnant women are also at the risk of COVID-19, as I said before. And like the pregnant women who are older, overweight and have some pre-existing medical conditions like hypertension or diabetes are at the risk of developing severe COVID-19 disease and complications. But the best way is prevention. So due to changes in their bodies and immune system, we know that the pregnant woman can be badly affected by some respiratory infections. But you have to take all the precautions, all the preventive measures to stop being affected with COVID-19. So as you know, wash your hands frequently, then keep your space between you and others, keep more space between them. And if you are pregnant, don't wear a fabric, wear a non-medical mask, fabric mask, where it is possible to keep sufficient physical distancing between yourself and others. If while you are pregnant, wear a non-medical mask. Okay. And practice proper respiratory hygiene. And there is a common question among the pregnant woman and their like bystanders, husband: can COVID-19 be passed from a woman to her unborn or newborn baby? Till to date, there is no evidence that COVID-19 can be passed from a woman to their child through blood or through milk, breast milk, or to the umbilical cord. So it is not transmitted via blood, umbilical cord or breast milk till date. So you can be sure that it won't be transmitted in such a way, but it can be transmitted if you are not doing the proper preventive measures. Better not get affected with COVID-19. If you experience any of the following symptoms, seek medical care immediately. Okay. And can I touch and hold my newborn baby if I have COVID-19? Yes, of course you can touch. But while you are touching, make sure that you are using a medical mask. You wear a medical mask, and you have to wash your hands before and after you touch the baby, as well as to clean each and every surface frequently, because mother's care is so much required for the newborn. Breastfeed them safely and with good respiratory hygiene. You have to do good respiratory hygiene. Hold your newborn skin to skin, like do all the care just like before, but make sure you do proper sanitization before and after touching the baby. Wear proper medical mask just for the safety of your baby. And how to stop COVID-19: wear a mask, maintain physical distance, eat healthy food, like all these, and get vaccinated. Don't hesitate it. And how the mutation or the new variants are coming in our society, and what we can do to stop the spread of the new variants. So let's see a small video. Here is like from one person to another. These colored ones are the new variants, and by each time the variants are becoming more and more stronger. Okay, like when the new variants are coming, it's becoming more and more stronger. So what we can do to reduce the effect? So if a person wear the mask properly when they are in the public, and if this person stayed at home, he can reduce, like if he feel any difficulties physically or any health issues, stay at home, get proper inform your healthcare worker, get proper care. Okay, if you wash your hands frequently, you can stop the COVID-19 spread and the new variant as well. If you get vaccinated, you can stop the new variant, new emerging variant, because it's coming to our body and it's going to another person. Sometimes it might do some changes in our body, like our body's immune system plus the coronavirus will have some physiological changes, and new variant will be emerging. So get vaccinated, stop it. So all these can stop the spread of new variant emerging. Get the vaccination at once when it's available. Wash your hands frequently. Keep at least 1 meter distance. Wear a mask properly. Okay, this is what we can do to stop the spread. And until this pandemic is over, only I and you can break the chain of the virus. And these are the reference that I use for this video. And thank you for your time, and hope this might be helpful for you. Thank you all, and take care. Stay safe, stay healthy.